Thank you for joining me today. In this video, we are going to learn language disorders, communicational disorder for children and younger adults. Communication disorder, neurological disorder characterized by the deficit in language, speech, or communication. Onset in early developmental period. So communication disorders, they are onset in early development period. They cause academic, social, and functional impairment. Communication disorder is not better explained by the intellectual disability, hearing loss, neurological disorder, or ASD. What are the types of communicational disorder? Communication disorders include the language disorder, that is the first one, and persistent, that is the persistent difficulty in elocution, usage of the language. Effects include vocabulary limitation and word knowledge, sentence structure, grammar error, discourse difficulty, connection, sentence, receptive and expression language deficit. Onset is a early childhood. They have academic difficulty are the most common. Language disorder equal to context and structural issues. Speech sound disorder is a difficulty producing speech sound correctly, leading to reduced intellectual ability. Substance and disorders. Speech sound disorder not due to structural abnormality, is not due to neurological injury, is not due to hearing impairment. And classic example is a child consistently says it instead of cat. Childhood onset disorder include disruption in a normal fluency and timing of the speech, include repetition, sounds, and symbols, prolongation, blockage, onset accommodation by the anxiety or avoidance that causes for the child anxiety and avoidance. Onset typically happens between 2 to 7, age 2 to 7. That's when the speech sound disorder is happening, or you can notice, or people who are caregivers can see that the child has disorder for speech, and it may improve with age. Risk factors include male, so the male develop more than the female. Family history will be the risk factor. Early onset will be the risk factors. Social communication disorder include difficulty with the social use of verbal and non-verbal communication. Impairments include use communication for social purposes, adjustment in language to context, following conversation rules, understanding implied or non-implied language. No restriction or repetition behavior, key distinctive from ASD. If the repetition behavior present that leads to autism spectrum disorder, not pragmatic communication disorder. And specific communication disorders include communication symptoms caused by impairment, do not meet fully critical criteria, for specific disorders, used when the information is insufficient. So how to assess and diagnose communication disorders? You will do developmental history. You will assess developmental history, speech and language evaluation, hearing assessment to rule out hearing loss, cognitive testing as indicated. You want to rule out intellectual disability. You want to rule out ASD. You want to rule out neurological disorders that causes the communication disorder. So, what is the treatment? Speech and language therapy is the first line of treatment. Early intervention improves the outcome. Parents and teachers' involvement are critical. You want to assess and address anxiety, learning disorder, social difficulty. No primary pharmacology treatment. There is no pharmacology treatment for speech disorders. So medication is only used for comorbidity disorders such as ADHD or anxiety and depression, if the child or the teenager have those. Prognosis variety depending on the severity, age of the intervention, presence of a comorbidity. So if the child have other diseases like a disability disorder, anxiety, depression, that can make it worse for the language and communication disorders. Many children may show significant improvement. Social and pragmatic deficit may persist into the teenagers years. So the language disorder affect vocabulary, grammar problems, social and speech sound disorders, affect articulation errors, fluency disorder, social dramatic disorder, social use of the language impairment, autism spectrum, affected communication, and repetitive behavior. So, communication disorder equal to neurodevelopmental. ADHD exclusion is a crucial. Think therapy, not medication. Think therapy when the child have a communication or speech disorder. Early speech delay is not equal to intellectual disorder. Dramatic disorder is equal to social communication only. Thank you for joining me today. I would love to see you in my next video, and please subscribe. Thank you.